Hello and welcome back to Chronicles of a Learner. On this page, I help you simplify and understand anatomy, physiology, and pathophysiology of systems and disease conditions. Today, we'll be looking at blood pressure. This will be part of a series where I describe blood pressure, the physiology of blood pressure, and the pathophysiology of hypertension and hypotension. On today's class, before we start, I would like you to understand a couple of terms. I need you to hold on to this understanding because we'll be needing it in the blood pressure class. So the first of these is stroke volume. When we talk about stroke volume, this is the amount of blood that the heart pushes out per beat. In our last class in the conduction system, and we described the heartbeat, we said the heartbeat is the relaxation and contraction of the atria and ventricles. For each time the atria and ventricles contract, they push out blood. That contraction and relaxation creates a beat. The amount of blood pushed out in each beat is what we call the stroke volume. And the heartbeat is the number of times the heart contracts and relaxes. The stroke volume is measured in mils per beat. That means how many mils of blood is being pushed out in a beat. Another thing I want you to know is about cardiac output. Cardiac output is the amount of blood pushed out by the heart per minute. So stroke volume is for each beat, whereas cardiac output is for each minute. So if the heart beats, say, 70 times in a minute, how much blood has it pushed out for that 70 times that it beats? So the cardiac output is a direct product of the stroke volume and heartbeat. So how much blood does the heart push for each beat? If you count that beat for a minute, how much blood do you get in general? That is what cardiac output is. The last term I would like you to understand before we move on to blood pressure is systemic vascular resistance. This is also what we call peripheral vascular resistance, and it's basically the force exerted on blood by the blood vessels. So as the blood moves through the blood vessels, the blood vessels generate or have a resistance which the blood must flow against to be able to perfuse. So the heart needs to overcome this resistance to be able to pump blood. In an attempt to overcome this resistance, that generates a pressure, and that pressure is what we call the blood pressure. So the blood pressure is defined as the force of the blood pushing against the arterial wall. It is basically determined by how much blood the heart has to push out and how much resistance the vessels give. So what influences this resistance is things like vasoconstriction, which is how much the vessels are constricted, or how tight the blood vessels are, or vasodilation, which is how loose the blood vessels are. So when the blood pressure, when the blood vessels are vasodilated, when there is vasodilation, which is when the blood vessels are dilated, there is a reduced blood pressure because the heart doesn't need that much pressure to push against an already loose blood vessel. And when the blood vessels are very tight, which is very constricted, then there is an increase in blood pressure because the heart needs to generate enough pressure to overcome this tightness to be able to perfuse, to overcome this tightness or this constriction of the blood vessels to be able to perfuse tissues and organs. Therefore, blood pressure is a direct product of cardiac output, how much blood is being pumped, and systemic vascular resistance, how tight or loose or how constricted or dilated the blood vessels are. So you see why I said you should hold on to the knowledge of those terms I described so that you can understand blood pressure better. Blood pressure is usually measured in millimeters of mercury, and it's measured with a sphygmomanometer. We have a systolic blood pressure and a diastolic blood pressure. The systolic blood pressure is the maximum pressure of the heart during contraction, while the diastolic blood pressure is the maximum pressure of the heart during relaxation. So systole is contraction. So systole is contraction and diastole is a period of rest just before the heart contracts again. So when we talk about the physiology of blood pressure, that talks about the normal. So we have to look at the physiology before we go into the pathophysiology, which looks at the abnormal. So in the physiology of blood pressure, we talk about how does the body regulate blood pressure? How does it try to, because there is a normal range of blood pressure, which we'll talk about later on. How does the body manage to keep blood pressure within these normal ranges? It does this with it does this with three methods: the autonomic nervous system, the hormonal or endocrine control, and the kidneys. The autonomic nervous system controls or regulates the blood pressure through what we call the baroreceptors, whereas the endocrine system or the hormonal looks at the renin-angiotensin aldosterone system, otherwise called RAS, and the antidiuretic hormone, also known as ADH. In subsequent lessons, we will be looking at the baroreceptors, the RAS, the ADH, and the kidneys before we move into pathophysiology. I haven't crammed them all into this class because I don't want to confuse you. I want you to take it gradually, so you can assimilate it better. As always, these pamphlets will be available on my WhatsApp channel for free. Remember to go and take a look so that you can save it and be able to glance at it whenever you are confused. Thank you so much for stopping by. I hope you've learned something today. If you have anything that you are confused about, put it in the comment section and I will be sure to reply and clarify you. Once again, thank you so much for joining in on Chronicles of Elena, where I help you to simplify anatomy, physiology, and pathophysiology. Don't forget to subscribe, like, and share this video to whoever might need it. You can comment if this video has helped you. Remember to share to whoever will need this video, a nursing student, a medical student, or any health professional who is just interested in knowing more about how the human body works. Don't forget to subscribe as well so that when I post a new video, you will be notified. Once again, thank you so much for supporting me, and I will see you in my next class. Bye.